Hello everyone. Today I am here to know about, is there any relationship between herd immunity and COVID-19? What is herd immunity and could it work with COVID-19? Let's see. People can become immune to certain viruses after surviving infection or being vaccinated. Typically, at least 70% of the population must be immune to achieve herd immunity. But how long immunity lasts varies depending on the virus. And it is not yet known how long COVID-19 survivors might have that protection. Herd immunity is when a virus can no longer spread easily because enough people are immune to it. That lowers the chances of the virus jumping from person to person and reaching those who have not been infected yet. Herd immunity happens when so many people in a community become immune to an infectious disease that it stops the disease from spreading. This can happen in two ways. Many people contract the disease and in time build up an immune response to it, that is natural immunity. And many people are vaccinated against the disease to achieve immunity. How does herd immunity work? Herd immunity only works if most people in the population are vaccinated. For example, 19 out of every 20 people need to be vaccinated against measles to protect people who are not vaccinated. If people are not vaccinated, herd immunity is not guaranteed to protect them. People who depend on herd immunity. Some people in the community rely on herd immunity to protect them. These groups are particularly vulnerable to disease but often cannot safely receive vaccines. People without a fully working immune system, including those without a working spleen, people on chemotherapy treatment whose immune system is weakened, people with HIV, newborn babies who are too young to be vaccinated, elderly people, many of these are very ill in hospitals. COVID-19 and herd immunity. The social distancing and frequent hand washing are currently the only ways to help prevent you and those around you from contracting the potentially spreading SARS-CoV-2, the virus that causes COVID-19. There are several reasons why herd immunity is not the answer to stopping spread of this new coronavirus. There is not yet a vaccine for SARS-CoV-2. Vaccinations are the safest way to practice herd immunity in a population. The research for antiviral and other medications to treat COVID-19 is ongoing. Scientists don't know if you can contract SARS-CoV-2 and develop COVID-19 more than once. People who contract SARS-CoV-2 and develop COVID-19 can experience serious side effects. Severe cases can lead to death also. The doctors don't yet know exactly why some people who contract SARS-CoV-2 develop severe COVID-19 while others do not. Vulnerable members of the society such as older adults and the people with some chronic health condition could get very sick if they are exposed to this virus. Otherwise, healthy and younger people become very ill with COVID-19. Hospitals and healthcare system may be overburdened if many people develop COVID-19 at the same time. Herd immunity for COVID-19 in the future. Scientists are currently working on a vaccine for SARS-CoV-2. If we have a vaccine, we may be able to develop herd immunity against this virus in the future. This would mean getting the SARS-CoV-2 in specific doses and making sure the majority of the world's population is vaccinated. Almost all healthy adults, teens, and older children would need to be vaccinated to provide herd immunity for the people who can't get the vaccine or who are too ill to become naturally immune to it. If you are vaccinated and build immunity against SARS-CoV-2, you most likely would not contract the virus or transmit it. Several experts have argued that only herd immunity could offer a lasting solution against the spread of the virus. We believe that it will happen soon, but till this day there are many controversies against this. In the same point it is good, but in the same way it is not good. But our prayer is a world without COVID. That's all today. See you on next day. Thank you.